Hi guys, today I want to talk about neck and shoulder pain and basically referred pain. A lot of people present with maybe no neck pain but pain in the back of the shoulder blade, down the arm, and actually that's known as can be referred pain from the neck, even though there's no pain in the neck. Basically, if you go through this, there's 7 vertebrae in the neck, 1, 2, 3, 4, 5, 6, 7, but there's 8 nerve roots, okay? So there's 8 nerve roots, right? If you think of the nerves like a electrical system where you've got 8 wires running into a box, well, basically the box in the body is called the brachial plexus. So these are the nerve roots, that's 5 down to 8, and they run into the brachial plexus. And then they run out into the individual peripheral nerves down the arm, which is musculocutaneous, median, ulnar, and radial nerve. Now, we know from our anatomy that these nerves, these peripheral nerves, are made up from different nerve roots. So the 8 nerve roots run into the junction box, and then the 3, 4 main nerves coming out are governed by these nerve roots. So, for instance, if somebody has got pins and needles and numbness in this part of the arm, we know that that's from the C5 nerve root. If they've got numbness in the thumb and first finger, that's normally C6. Third finger in here is C7, and these fingers here are C8. So people with pins and needles, numbness in those hands, we know from our anatomy that's pretty much the level of the neck that the problem is. That's known as the dermatome, so the skin levels where the numbness is. Also, on neurological testing, we can test the muscle power, which is called the myotone. And again, pushing the arm upwards, which tests bicep, but also the C6 nerve root. Pressing down, tests the C7 nerve root. Pressing the thumbs up, tests C8. And pushing the fingers in, tests C1. So if there's weakness here, we can deduct again that the nerve root of a certain level is affected, okay? So this is known as referred pain due to, say, a disc in the neck. You see it a lot, and it's very hard sometimes to explain to people that the pain is from the neck, it's referred into the arm. So the symptom is the pain in the muscles that are innervated by that nerve, but the actual problem is in the neck. Now, if we look at shoulder pain, basically joint pain normally stays local to the joint, so it doesn't actually spread down the arm unless they get a subacromial bursa, which is the subacromial bursa here. It's a little fluid-filled sac and gets inflamed. Now, in contact sport like rugby, impact on the shoulder can cause this bursa to be inflamed and raised and then cause impingement. If that happens, normally the course of treatment is a corticosteroid injection to reduce the inflammation and cause the bursa to shrink back to size. Sometimes we get degeneration in the joint, so you get osteophytes or extra calcifications, which is extra bony growth. This will cause it to rub on the bursa and cause it to inflame. So again, you may inject a steroid, it may calm things down, but if it returns, well then basically sometimes microsurgery is done to basically shave off the bits of jagged bone that are causing the frictioning on the bursa. Down here, I don't know if you can see, but the rotator cuff tendons are on here, which there are 4: supraspinatus, infraspinatus, teres minor, and subscapularis. Again, if these are torn due to trauma or injury or degeneration, will cause pain local to the shoulder, maybe some referral into the upper arm, but not a lot. Yeah. The other thing in the shoulder that can cause pain is the joint capsule. We've heard of frozen shoulder, which is adhesive capsulitis. Well, this is the capsule getting inflamed. And again, early intervention is very important with this because if not, it can lead to full-blown frozen shoulder, which can take a long time to repair. Other things in contact sport, like stingers. Stingers are referred pain down the arm, and basically it is again a blow to the shoulder which will affect the brachial plexus here, which will cause pain in the shoulder but will refer down into the arm, like a dead arm feeling, yeah? Normally this is short-lived, it clears up in 5 minutes, 10 minutes, but on occasion sometimes the brachial plexus is damaged, and then obviously things have to be done to try and correct that and help that. I hope this helps with regards neck pain versus shoulder pain. Basically, Neck pain can refer into the arm and down the back of the shoulder. Most shoulder joint pain will stay local to the actual joint itself. Okay guys, see you later. Bye bye.